We're going to be talking about GP services. We were talking earlier on in the programme about whether you were struggling to get a doctor's appointment. And sometimes when we struggle to do that, lots of people turn to the internet for help. Lots of people Google their symptoms, although we're often told that's a bad idea. Others, of course, go a step further and they use online GP services to get a diagnosis or even a prescription. But 4 in 10 online GP services in England aren't completely safe to use. That's according to the health regulator. Well, inspectors from the Care Quality Commission found problems with prescribing drugs and carrying out checks on patients. Well, we can speak now to Professor Steve Field from the Care Quality Commission, also Professor Helen Stokes-Lampard, who is from the Royal College of GPs, which says it's been actively raising concerns around patient safety in regard to online GP providers, and also to Dr. Mobasher Butt, who is the Medical Director of the digital care provider Babylon. Thank you all for coming in. First of all, I want to begin speaking to you, Professor Field, if I may. What are your concerns that you've found of these providers?
Well, first of all, we actually regulate the traditional GPs as well as online. And so specifically looking at online, we found some concerns in the safety areas about prescribing for antibiotics, the potential to prescribe a lot of opiates, codeine-based painkillers, some issues about making sure it's the right patient in front of the person or online on the phone or using
Proving
the form system. So that's right. But I must say that while we raised these concerns right at the start when we first inspected, there has been a lot of improvement, and we will continue to go back and make sure they're improving as time goes on.
What are the regulations surrounding online GP services? Are they different to the surgery that you would walk into, or are they exactly the same? Well,
we believe we should be looking at the same standards. In fact, the disruption, if in a way in a clinical sense, is not the fact that you're doing something online. Because we've used the telephone, we've used Skype consultations for many years. This is really about looking at the patient in front of you, making sure you're aware of their history, listening intently, and then if you need to examine, then you need to make it easy for the patient to then seek someone to be examined. That's the only part of it which is different to a face-to-face consultation.
So if people are watching this at home and saying, well, how on earth do I know if this online service that I'm going to is a good one or an unsafe one? What should they do?
Well, first of all, we regulate in England, and so patients should look for the Care Quality Commission logo and read the report about the provider. That's the first thing. Because if we do have some concerns, they're clearly articulated in that paper. Well,
but realistically, if your child's really ill, you can't get a doctor's appointment, you're not going to say, I'm just going to go and check that online provider's report, are they? It's the CQC stamp on the website that you would see?
It will be on the website, right. But if people are wanting to sign up for one of those providers, you make sure that we regulate it in England, and we only have jurisdiction over this country.
And expansion, presumably, is likely to happen in years to come by the very nature of the way we lead our lives.
So I'm a GP, I'm also male, and as a patient, these sort of services are services that I would personally use in future, being busy at work and whatever, but we need to make sure that they're safe and effective, and that they link into their NHS GP by contacting them, being able to get past histories, etc.
I want to bring in Professor Helen Stokes-Lampard now, because I know that you do have some concerns about these online providers. Just explain what those are.
Sure. Thanks, Chloe. Yes, the concerns aren't that they're online. The concerns are about regulation and safety, echoing what Professor Field has said. Really, what we want is an NHS service that's fit to provide all these services for patients fairly, equitably, and that's based on evidence and the evidence of safety. What we've got at the moment is a changing market. We've got an NHS that's underfunded, insufficient GPs, so people, as you say, are looking for alternatives for a quick fix to their problems. But we mustn't destabilise the NHS in doing so, and we must ensure that what patients are getting is the safest possible care. I mean, it's crazy. If we're allowing people to function, to access services that aren't safe, we won't allow allow it in the NHS, so why should it be allowed in the private sector? We need the private sector regulated in the same way that the NHS is. That's all we're asking, the same standards, evidence-based, fair for all. And also there are issues about equality of access. You know, for people who are not able to access these services, we're bringing in greater health inequalities, and that's a concern to us. As a GP, I want every person in this country to have great care.
What about the idea of antibiotics, for example, being too readily handed out? Is that a specific concern of yours?
That's one of the specific ones. So we all know by now that antibiotic overuse is a challenge for the whole country, for the whole world, because of the inappropriate usage leading to resistance of antibiotics. And so there has been evidence in the past, some of it brought out by these reports, that some of these providers haven't been taking the necessary checks. Because they're doing things online, they haven't been able to listen to a person's chest or look in their ears to check if antibiotics are really what's needed. And we mustn't be using these apps to shortcut good quality clinical care.
Dr. Butt, lots of accusations there, lots of concerns. As a medical provider online, how do you respond to them?
Well, I guess the first thing to say is that we were in a fortunate position in that our report was overwhelmingly positive in the areas of safety, effectiveness, responsive, well-led, caring. And so I think it's really, really important that online services do deliver safe care. And I think it is possible, and we've found that it's possible to have really good policies and guidance for clinicians to do this kind of care safely. And I think the bottom line is, I think, you know, digital technology gives us an opportunity to actually deliver even safer care. So, as an example, our technology allows patients to book an appointment in seconds. You can see a GP within 2 hours.
How much does that cost?
It's completely free for our GP at hand service. So that's a completely free service, 365 days a year, 24 hours a day.
You have to sign up to it, presumably,
and pay. You do, yes. So, you don't have to pay.
Okay.
It's a completely free NHS service.
Do people have to pay for their prescriptions? I'm just wondering if some people are feeling that antibiotics are too readily being handed out. Is this about a money-making exercise?
I don't think it's a money-making exercise. I think that patients have to pay for an NHS prescription if that's what they need to do. Some people, of course, are entitled to a free NHS prescription, and that's exactly the same as it would be if you went to see a GP face-to-face.
Just to clarify, there are two things we're talking about here. There is one NHS service called GP at Hand that Dr. Butt represents, and so they are an NHS service and they are regulated in the same way that any other GP service in the NHS is. But most of what this report is about the private providers of online services, and those people do pay for their appointments, and then they would pay for their prescriptions. So that's to clarify that. Yeah.
Let me just read you a couple of comments which have come in to us. Sammy on email says, online doctors, I've used these services rather than face the nightmare of trying to get a GP appointment. They are only unsafe when people abuse them to get medications their GP would refuse to give them. If you have a genuine problem, they are a much needed accessible service. And someone else has tweeted to say online doctors can be very dangerous as they can't test you as well as face to face. Also, this is one of the backdoor privatisations of our NHS. Remember that no laws protect you from online medical services from the private sector. Is that true?
Well, we regulate private providers as well as the one NHS provider at the moment in England. So we're talking about the English NHS, and we need to make sure that all the services are safe and effective, just like if you're going to your own GP wherever you live. I think the future will be a blended service where you do get access to online consultations, video consultations as well as face-to-face. But at the moment we're not there yet, and our job as a regulator is to make sure that the patients in England are safe, and that is what we're doing.
Yeah, just to pick up on a point someone made in the email, so I think it is possible to safely examine patients via video. So if someone presents to me as a GP on video, I can accurately assess the back of their throat, I can look at their joints, I can look at their skin. It does, of course, have some limitations if I need to listen to their chest or look in their ear. And of course, all of those patients must be referred to have a physical assessment, and we have provision for that.
Thank you all for coming in to talk to us this morning.
Thank you.